The Sisters of St. Francis legacy begins when Maria Anna Boll-Bachmann, an immigrant from Germany, opens her home in Philadelphia to immigrant women. Committed to helping the poor and sick, Maria Anna seeks advice from Bishop John Newman about forming a congregation devoted to serving the Lord through corporal acts of mercy. In 1855, with Bishop Newman's acceptance, the Congregation of the Sisters of St. Francis of Philadelphia is founded. Maria Anna, recognized as the spiritual leader, is called Mother Francis. In 1858, the city of Philadelphia is caught in the grips of an epidemic of smallpox and turns to the Sisters of St. Francis. Although none of the sisters are trained nurses, they are proficient in caring for the sick and earn a reputation for providing Christ-like charity. In 1860, Mother Francis, unable to accommodate the many sick at the convent, secures a larger building. Named St. Mary's Hospital, the new facility is dedicated to the Blessed Mother of Jesus. This officially begins the Order's journey into healthcare. In 1863, Mother Francis contracts tuberculosis and dies at the very hospital she has worked so hard to establish. Mother Agnes Bucher becomes the second Superior General of the Sisters of St. Francis. Under her supervision, the order grows to more than 800 sisters, serving in 88 missions and 19 dioceses from the Atlantic to the Pacific Oceans. In the 1950s, the Archdiocese of Philadelphia purchases a 73-acre horse farm in rural Bucks County, a bucolic property known as Buena Vista. In 1966, the Sisters of St. Francis of Philadelphia respond to a study that indicates the need for a hospital in the rapidly growing community of Lower Bucks County. Sister M. Clarence Naughton, now known as Sister Claire Naughton, becomes the first administrator of St. Mary Hospital, Langhorne.
To locate a brand new hospital where a hospital didn't exist before, and to try to evaluate the needs of the community and provide for those needs, to recruit medical staff. It was just very exciting. And we wouldn't even have broken ground if we didn't feel that there was great acceptance on the part of the community. And they not only accepted, but they supported us in every way they possibly could.
The new St. Mary Hospital opens its doors in 1973. With 156 licensed beds and a medical staff of nearly 200, it is the first and only Catholic hospital in Bucks County. When Sister Clarence is transferred from St. Mary in 1977, Sister Suzanne Marie Evans carries forth the vision, turning the hospital into a regional medical center. Under her direction, the first major expansion of the hospital begins. Sadly, Sister Suzanne Marie Evans passes before seeing her projects come to fruition. In 1982, Sister Claire Carty becomes president and CEO of the hospital.
So we really began to shift from a sick model, acute care model, to a holistic one, where we're very concerned about the spiritual, physiological, as well as the sickness. And there's a very wonderful spirit of giving among doctors, nurses, direct caregivers of all sorts, as well as our pastoral ministry.
In 1987, St. Mary Hospital meets stringent state specifications required for designation as a Level 2 regional trauma center, and it remains the only state-accredited trauma center in Bucks County today. As the medical center expands and adds services, it is committed to carry out the Sisters of St. Francis' dream of providing community outreach. In the early 1990s, the Mother Bachmann Maternity Center opens its doors in Bensalem, providing pregnant women with prenatal and obstetrical care regardless of the ability to pay. To address the need for access to adequate and affordable health care for children, The St. Mary Children's Health Center opens in the same Bensalem shopping center. The St. Mary Family Resource Center follows, offering comprehensive social and enrichment programs. In 1999, Sister Claire Carty, who guided St. Mary for 17 years, steps down as president and CEO, and Greg Wozniak becomes the first layperson to hold the position.
We often say, and the sisters will say this too, we're a reflection of our community. And as our community has grown, and with the age of our community, the services they require St. Mary. And when we look at our mission, we make sure that's built upon what the community needs. Not what we need, but what the community needs.
During the 20th century, the leading causes of death in the United States shifted from infectious diseases to chronic illnesses, such as heart disease, cancer, and diabetes. Understanding that these diseases often are preventable through early detection, improved diet, exercise, and treatment, St. Mary begins to move toward a health promotion culture committed to providing solutions to prevent disease and improve health. Under Greg Wozniak's leadership, St. Mary continues to grow, expanding its cutting-edge technologies to emerge as the most comprehensive medical center in the area. Our prominent cardiac care program opens a dedicated cardiovascular care unit in 2006 and unveils 4 new state-of-the-art cardiac catheterization laboratories in the St. Mary Heart and Vascular Center in 2009. To better serve the community, St. Mary completes a major expansion of its emergency department in 2006, including the Pediatric Emergency Care Center, the first and only of its kind in Bucks County. The St. Mary Regional Cancer Center demonstrates its steadfast commitment to fighting cancer by offering sophisticated technologies and providing comprehensive care for those who turn to the center each year for diagnosis and treatment. To meet increasing demand for highly specialized and minimally invasive orthopedic procedures, a new orthopedic surgical suite opens in 2006 for total joint replacement surgery and other sophisticated orthopedic procedures. The Center for Joint Replacement at St. Mary is the first in Pennsylvania to earn the Joint Commission's Gold Seal of Approval. Moving forward, St. Mary continues to develop and expand its comprehensive neuroscience services to help meet the need for advanced treatment of stroke, cancer, trauma, chronic neurologic conditions, and brain disorders. In 2008, the St. Clair Medical Building is constructed on the hospital campus and includes the St. Mary's Sleep-Wake Disorder Center, one of the largest of its kind in Bucks County. To help older adults in Bucks County live independently and safely at home, St. Mary introduces Life St. Mary. This innovative model includes a compassionate team of healthcare experts and a wide range of services offered at the Life Center, which opens in Trevose in 2010. Expanding on excellence. Your Health, Your Hospital capital campaign raised $10 million for St. Mary. The new emergency department has 18 new patient care rooms, 2 new trauma bays, and a dedicated CT scanner to rapidly evaluate critically ill patients when they arrive. The new ambulance entrance gives direct access to the pediatric and adult areas. The new patient entrance leads to a large reception area and the expedited treatment area, where patients are immediately evaluated by a coordinated team of medical and support personnel. The 20-bed intensive care unit is built to treat a variety of complex, critically ill patients. It is divided into 2 separate units, the neurotrauma and a medical surgical side. Each features large-sized rooms with private baths, specially designed beds with patient lifts over the beds, and a sleeping area for a visiting family member. The surgical expansion encompasses the building of 2 new operating rooms, one for our endovascular neurosurgery and transcatheter aortic valve replacement, and the other for robotics. Other operating rooms will be expanded in size, and new preoperative and postoperative patient areas, along with a new family reception area, have been added. To align with our private patient room strategy, 24 new critical care private patient rooms have been added to accommodate the growing needs of our community. These achievements and milestones are shining examples of how St. Mary continues to be the leading medical provider in the region. Mother Mary Frances Bachman once said, "I care little if I have many sisters, but it is important to me to have good and faithful sisters." Today, several of her good and faithful sisters carry on the Order's mission at St. Mary. More than 150 years after the founding of the Sisters of St. Francis of Philadelphia, the commitment to the healing ministry continues here at St. Mary Medical Center, where we are dedicated to serving the physical, emotional, and spiritual needs of all who entrust their lives to our care. Only with your help, our generous donors, can we accomplish so much and help so many. On behalf of St. Mary Medical Center and the St. Mary Foundation, thank you for supporting our mission, celebrating with us 40 years of serving the healthcare needs of our community, and joining us on our journey as we look towards the future together.